Hello viewers, this is Dr. Praveen Kumar and you are watching Dr. Kumar Healthcare. Today's topic of discussion is regarding piles. Piles is an common disease entity which is present in the Indian subcontinent. Piles happens because of a bunch of venous plexus which gets bulged at the level of anal cushions. Piles may happen at any age and there is no any gender discriminations. Many factors are included which contribute to the development of the piles. These contributing factors could be our poor lifestyle, our poor dietary habits, or else it could be due to the obesity, or else it could be due to pregnancy, or it could be due to our multifactorial athletic work and heavy weightlifting works. So all these factors will lead to the development of constipation and irregular bowel movements. This irregular bowel movements and constipation in turn will put a lot of pressure over the anal cushion and slowly the venous plexus starts bulging. Depending upon the slow progression of bulging of these venous plexus, we stage them into stage 1, stage 2, stage 3 and stage 4. Of course, having said, stage 4 is the last stage wherein the pile mass will come out of the anal canal and it will start profuse bleeding. Coming to the factors of complications related to the piles, one of the most important complication of piles is profuse bleeding and anemia. You may tend to lose a lot of blood which goes unnoticed in your day-to-day activities. Henceforth, it is always advisable for patients to visit your nearby doctor as soon as possible whenever you notice an bleeding from anal canal. Second most important complication is repeated infection. Third most important complication is due to presence of thrombosis in the piles, which in turn will lead to the gangrene of the piles. Now in our clinic, most of the patients, they come with a history of piles and they are afraid that these piles will turn into cancer. Let me clarify this point in a very straightforward way that piles will never cause cancer. However, cancer, colonic cancer, rectal cancers may cause piles. So to say that piles will never cause cancer, but cancer may cause piles. Let us come to the symptoms of the piles. So as I have described about the risk factors and complications, bleeding will be there. So bleeding is the main symptom of piles. Second most symptom is that patient will have itching sensations over the anal canal. Third important one is the pain. Fourth and most important one is that uncomfortable in a sitting posture or during office hours. Now let's come to the treatment of piles. Treatment of piles is purely and surgical based. There is no medication for the piles, only and only surgery. However, you can opt two modalities of surgeries, either traditional open surgery or else the modern and advanced technology of the lasers. We recommend patients to undergo the laser treatment compared to the open surgery because laser treatment will provide high accuracy rate, number one. Number two, it provides with a minimally invasive technique, that is there is no cuts. Third most importantly, there is no bleeding. Fourth and very important factor is that patient can rejoin his office on the next day itself. Henceforth, we recommend to undergo laser treatment. For further informations, you can log on to our website or else you can contact to our Dr. Healthcare Clinic Center. Thank you very much.